Good afternoon, sir. My name is TJ. I'm going to be your nurse today. Could you give me your name, full name, and date of birth? Okay, great. That checks out. We're going to be doing a physical examination before you see the doctor today. We'll start off with doing your vital signs, and then we're going to do a little mental health to see how you feel about life and things in general. We're going to assess your respiratory system, so we're going to look at your breathing. We're going to look at your cardiovascular system, so like checking out your heart. And then we'll finish up with a abdominal digestive review. Okay, does that all sound good? Great. In order to do those tests, I'm going to have to look at different parts of your body. I'm going to have to listen to different parts of your body with my stethoscope. I'm going to have to tap against different parts of your body. I'm going to have to press against different parts of your body. You're okay with all that? Okay, great. Well, why don't we get started? My first question is, why are you here today? Is there something that brought you to the doctor's office that I should pay attention to? Okay, great. And do you have any pain or any discomfort that I should be aware of? Okay, great. Well, why don't we start with your vital signs? Let me take your hat, sir. Put that over here. Great. So I'm going to just apply a blood pressure cuff and your blood pressure. Take that off. I'm going to use an alcohol swab on a finger and then attach the pulse ox. While that's going, I'm going to assess the patient for the respiratory rate without them knowing. Great, okay. Take the pulse ox off, and so I'm just gonna put this temperature probe into your ear to get your body temperature. Okay, great. Thank you so much for all of that. So can you tell me where you are, why you're here, what the date is, who the president is? Okay, great. And I'm gonna give you 4 words right now. They are key, flower, automobile, and plate. Key, flower, automobile, plate. Can you repeat those to me? Okay, great. Now I want you to remember those. I'm going to ask you to say them again at the very end of the assessment. All right. Now tell me a memory about your childhood. Like, where did you grow up? Did you have a favorite pet that you really loved? Oh, that's really sweet. I think that's great. Now, have you felt hopeless, down, depressed, anxious? Yeah. Okay. And do you smoke? Do any drugs? Or drink alcohol? And please be honest with us. We're here to help you, and we need to know everything. So if you just let us know, that'd be great. Okay. So you said you drink. How many drinks a week on the average do you consume? Okay, great. Well, let's move on. Let's look at your respiration and your lungs. So there is no clubbing in the paw, and the capillary refill time in the fingertips or claw tips is normal. Have you had any chest injuries or surgeries since your last physical that we don't know about? Okay, great. And let me just look at your back here. Okay, spine is nicely aligned and all the right curves in all the right places. Okay, fantastic. Now, I'm gonna kind of touch a bunch of different points in your chest and let me know if any of these are tender or painful in any way. Okay, great. No pain? All right. Now I'm just going to do the same thing. I'm going to tap against your chest. Okay, that all feels good. Now I'm going to listen to your breath sounds with my stethoscope. Each time you feel it against your skin, I want you to take a deep breath in and let it back out. And if you start to get lightheaded, we can take a pause so you can get your, so you're stopping dizzy. Okay. Okay. This all sounds good. All right, we're going to do the same on the back. So I'm going to just turn around. Okay. Now cross your arms in front of your chest and grab your shoulders. Okay. And now we're going to do the same breathing exercise. When you feel the stethoscope, just take a nice deep breath in and let it out. Okay, fantastic. Now I want you to take another deep breath in and let it out. Another deep breath in, let it out. Okay, great. And we can move on to your heart. So facing me again. So do you have any family history of heart disease, like heart attacks or hypertension, like high blood pressure? Okay. And do you exercise? Okay. And for how long? Does your owner take you for walks? Okay, good to know. And have you had any chest pain or any kind of problems breathing? No. All right, great. Skin looks good. There's no turgor or tenting. Skin is dry and nice and properly warm. And let me just check your eyes here. Your pupillary conjunctiva look great. And let's see, carotids feel good. And we'll just listen to those for a second. Great. Okay, I'm just gonna take my pen light and check your jugular vein. Okay, everything looks good and normal, wonderful. So I'm just gonna take the front of your gown down so I can take a look at your chest. Okay. Thank you. Everything here looks good. And I can see your apical pulse here, and it's nice and strong. And if you just lean forward a little bit, and I'm going to listen to your heart. Okay, great. And we're just going to do the last assessment. We're almost done here. So would you lay down for me and cross your arms over your chest? And I'm just going to lift your gown up and take a look at your stomach, abdomen area. Okay, everything looks good. It is protuberant, but that's totally normal for your species. It's supposed to be like that. Let me listen to your bowel sounds. Okay. Looks good there. Now I'm going to press on your lower abdomen in a couple different places, and if you just raise your head up each time I press on it and let it down. Okay, great. Okay, was any of that tender or sore in any way? No? Okay, good. Now I want you to lift your knees off the table and put your feet flat against the table. And let me know if any of these points are tender. Okay, great. And if you just sit up, and I'm going to come around the other side here, and check your kidneys. Okay. Does any of that feel painful or sore or strange in any way? Okay, great. Well, that's everything. Now, can you recall those 4 words I told you at the beginning of our assessment? Okay, great. Perfect. Now, for instance, you're in pretty good shape. Your heart rate's a little high. And from what you told me, it sounds like you probably should be getting more exercise, so you can use this totally as an excuse to get your owner to take you out and throw the stick more often and for longer. That'd be great. We recommend 30 minutes every day of exercise. Do you have any questions? No? Great. And the doctor will be in to see you shortly. Thank you so much.